Hello and welcome back to Instagram Live with Intimate Rose. I'm Dr. Amanda, and today I will be joined by Jaclyn of the Lost Labia Chronicles. Jaclyn is going to be sharing about a condition called lichen sclerosus. We'll talk about her journey and the amazing advocacy work. Instagram. Jaclyn has a PhD in scientific research analysis, and this has empowered her to really evaluate the scientific literature and understand it and advocate for others. Hi, Jaclyn. Welcome.
Hi, how are you doing?
Good. I was just talking all about your education and the amazing work that you do. Thank you so much for joining me today.
Oh, thanks. It's my pleasure. Happy to be here.
So today we're discussing lichen sclerosis.
Mhm.
Of course, I have my vulva model and my pelvic floor
Of
model.
course.
And then I also have fun tools that we can discuss for
Amazing.
management as well. But I did a very brief introduction of yourself. Would you help people understand your background and who you are and what you do?
Yes, of course. So, yeah, my name is Jaclyn, and I started having symptoms when I was in my early 20s. And for me, initially it was kind of manifesting more as discomfort with sexual activity. I wouldn't use the word pain at that point, but like something just didn't feel quite right, but not enough to alarm me. As the years went on, though, that discomfort definitely moved into what I would start to say was pain. So it was very burny type pain. I had a lot of burning with kind of intercourse type activities, but I also tore open at almost every attempt. And that was, well, A, it was very distressing, but it was also very confusing because when I would chat with, my friends, I was like, why don't they ever talk about the tearing open part of sex? Why aren't we talking about that? And so I did try to, get some answers from healthcare providers. I was in and out of different clinics for about 10 years. I was constantly told that you're just stressed. You're really type A, and if you could just learn to chill out a little bit, you'll see this will all just go away. Or it's normal and okay for women to have some pain. Just have a glass of wine and you'll be able to get through it. So I kept kind of in and out, and I would go to even STI clinics because initially I had very poor sex education. And back then, I thought if you had symptoms in the vulvovaginal area, you're dealing with a yeast infection or you have an STI. I didn't know there was anything else really. So I was thinking it has to be an STI. They're missing something. So I would often go to STI clinics, get a panel done. The panel would come back negative and I would actually be disappointed. I would go into those clinics really hoping that they would tell me you have an STI, because then there would be a name for what I was experiencing, but also there would be something I could do to help alleviate the symptoms and bring back my quality of life. But time and time again, it was, you're fine, there's nothing wrong with you. Fast forward to I'm doing grad school, it's my PhD. I moved to Toronto, Canada, and I find a clinic that allegedly specializes in kind of women's healthy type stuff. So I thought, oh, maybe this is where I need to go. Let me try here. And so I went in. It was a walk-in. I was the first one there. It was like 7 a.m. Had my coffee, first in line, so gung-ho. They're probably like, what are you doing? But I just wanted answers. So I get in, and the clinician took my history, and then in her defense, she did do a full exam of the vulva, but then said to me, yep, you look fine. There's nothing wrong with you. I can't do anything. Have a nice day. So I was like, okay. So I was about to leave, and she goes, oh, well, you could have multiple sclerosis. But in any case, I can't do anything there either. So have a good day, which really threw me through a loop because my mother actually had like multiple sclerosis growing up, and she
Oh,
passed away when I was 21. And so
oh no.
because MS can be genetic, that really messed with me, right? Because now I'm thinking, okay, I have something wild going on with my vulva, but now maybe I have the same autoimmune disease that, my mother had. So I left there pretty distressed, but I also left there saying, cool, I'm done. No more healthcare providers, because this was 10 plus years now where I was told that I was the problem. And at this point, I truly believed that I was. I was like, I mean, this is like a women's health place. And she said I was completely fine. So this really must be a me problem. And there's clearly nothing that healthcare providers can do for me. So I kind of resigned that that was the last time I was going to talk about my vulvar issues in a healthcare setting. A week later, I finally got a family doctor, and I went to go see her, and I was actually there because I have degenerative disc disease. And so I wanted to talk about my low back pain, but I made an offhand comment about my vulva, and she said, hold on a second. Tell me more about the vulva stuff. We'll get back to the back, but I want to hear about the vulva stuff. So I told her pretty much what I had told you. And she goes, you know, as your family doctor, I'd like to be the one that says there's nothing wrong. Would you mind if I took a look? And at this point, I was like, yeah, I'm here. What's one more, right? So get in the other room, you know the drill, undressed, waist down, lie in the stirrups. She knocks on the door, comes in, not even 2 seconds of looking at my vulva, and she goes, Jaclyn, you have lichen sclerosus. And I remember saying, sorry, what? Because I'd never heard of that before. She then proceeded to do a full clinical examination, really looking at the clitoral area, the labia, and she was describing what she was seeing at the same time. So the clitoral hood had completely covered over and scarred over the clitoral glands. The labia minora, so the inner lips, had completely scarred to the outer lips, the labia majora. There was nothing left. At this point, all of the tissue, the vulvar tissue, was white, white, white. There was thick areas and areas that look all crinkled. And so she said, this is definitely textbook lichen sclerosus. Put your clothes back on. We'll chat in my office. She gave me the biggest little Coles notes. Here's what it is. Here's a prescription. Go see a gynecologist for follow-up. And I was out the door. And that first year of processing that diagnosis was definitely a big challenge for me, not only in terms of managing the physical side of things, but it was a real big mental health challenge for me. And we can chat more about these things later. I'm just giving a high level overview. But what I did notice was that when I tried to find information about my condition at the time, all I really found was medical articles saying use steroids. And I was like, well, okay, no, I know that part, but like, you know, how can I have sex again? What kind of underwear can I wear? Do I need to make any special considerations with respect to how I wash myself? All of these questions I couldn't find any real answers to. And a few months later, I connected with Lichen Sclerosus podcast. Kathy from Lichen Sclerosus podcast, and she slid into my DMs and was like, hey, I see you have LS. You should listen to my podcast. And I was like, okay. And then on her podcast, she put out a call for folks to share their story. And I was like, why not? Let's go. So I shared my story. And then a couple weeks later, she was like, I'm doing this virtual meetup for folks with lichen sclerosus. Would you like to join? Of course, I said yes. And after that first meetup, she was like, you're incredible and you need to come to all the meetups and you need to do this with me. And I was like, okay, let's go. And that was kind of my journey into the patient advocacy and support space, was through Kathy from Lichen Sclerosus podcast and then Lichen Sclerosus Support Network. And I would talk so openly about my struggles and what I was going through. Everyone was saying, you should start a blog, you should start YouTube videos. And so I did. And then fast forward to today, and I'm knee deep into patient advocacy. I do a lot of special training programs in North America and Europe for patient advocacy work. I am the Chief Research and Provider Relations Officer at Lichen Sclerosus Support Network, which is an LS nonprofit. I do a lot of content creation, and my content creation really focuses on knowledge translation. So going through the medical journals, reading through those studies, and then translating that into something that the patient community can not only understand, but feel safe reading. So not having any language that can be really, really triggering or upsetting, because you can read some of these journal articles and not only are they heavy on the medical journal, the medical jargon, but they also use words like disfigured that can be really, really hard from a patient perspective for us to hear those words being used about our bodies. So just making sure also that it's written in a way that feels safe, comfortable, and warm. So that is like my journey in a nutshell and how I kind of moved into the content patient advocacy side of this.
Oh my goodness. I'm so sorry for the way you were treated. I hear this every day, and
Mm-hmm.
it sounds similar to my journey, but differently. I have celiac, and I was also
Uh,
told you're a type A. I was in my doctoral program. What do you expect? You're
mm-hmm.
stressed out. You have no money.
Right.
Like,
Yeah, which like fair, but also no.
right. So I'm so thankful for that provider that finally gave you the answers. And then additionally, you have a PhD in scientific method and understanding.
Mm-hmm.
What a tremendous gift that you're giving people by helping them to better understand it and understand in a way, as you mentioned, that is warm and approachable and not triggering and detrimental to their mental health. And
Yeah.
then you touched on the mental health aspect. Do you want to delve more into that?
Yeah, it's funny because I was just doing an interview an hour ago with a woman that has both lichen planus and lichen sclerosus. And we were talking about how challenging the physical symptoms are, but how the mental health side is almost worse. The feelings of shame, embarrassment, the feelings of, am I ever going to be able to have a relationship? What does this mean for my relationship? All of the fear and insecurity that comes with having a condition like this. And because we're often told at the time of diagnosis, you have LS, by the way, this can turn into cancer. Okay, bye. And that's it. No context, no nothing on prevention. And that lack of context is terrifying because when I hear this can increase your chance of cancer, I'm like, by how much? 70, 80, 90%? Am I guaranteed to get cancer? Is it a matter of time? I don't know. For the record, it's approximately 2 to 6% of people with untreated vulvar lichen sclerosus can go on to develop vulvar cancer. That risk is slightly above baseline population, but when you treat properly and consistently with topical corticosteroids, that risk goes right back down to baseline. And so that didn't take me too long to explain.
Yeah.
But, so that little bit of context really does make a big difference, though, because, again, some of us are thinking it's like an 80% risk, or I'm going to get vulvar cancer in the next year. And so a lot of us are just terrified, and that can set off kind of these health anxiety moments, which is definitely something that happened to me. A lot of depression and anxiety. We can see this in the quality of life studies that are out there, that we see there's a huge mental health impact and burden for folks with lichen sclerosus. And so that's something that I definitely try to emphasize in all interactions with clinicians and researchers. As as much as we need treatments, we also need support for the mental health side of things, because it can be incredibly challenging for many of us.
Absolutely, undoubtedly. And, it was such a frightening thing to hear on top of a new diagnosis that
Right.
perhaps the scariest diagnosis for everyone with the cancer. So topical steroids are
Yes.
one of the known first lines of treatment for the tissue itself. What are some other either medications or over-the-counter methods that you have found to be helpful in managing LS?
So if we're talking from a personal perspective, my case is really lucky in the sense that I responded very well to first line treatment, which was for me was topical clobetasol. So I used that medication. That medication got my case into remission, and I still use it on a maintenance dose twice a week to this day. So I never had to go into second line treatments, which are topical calcineurin inhibitors. So they're a non-steroidal ointment or cream. They're going to work similarly to calm that immune response in the tissues, but they're not themselves steroids. So they can be nice for folks that either do not want to use steroids or who do not respond to steroids, because, there's no treatment that's going to work for everyone across the board. This is true for any condition. Even something as simple as penicillin for sore throat, right? Some folks are allergic to penicillin, can't take it, so it's not the be-all, end-all. Same thing for steroids. I never had to move into the world of calcineurin inhibitors, though, because for me, steroids just worked. So that was a big piece of getting me kind of into remission and getting me well managed. The rest I put together on my own. So as I left, I had that prescription for the clobetasol in my hand and I was walking back, and I remember thinking, I need to do two things and I needed to do them ASAP. I need somebody to help me with the mental health side because this is going to destroy me, and I knew it. And I thought, I think I need to go see a pelvic floor PT because I want to address the physical side of the painful sex. Because even back then, I knew that the vulvar tissues, it was more than just the vulvar tissues, right? Like, yes, that's the affected area, but all parts of our body are interconnected. And so I knew, that the pelvic floor muscles were probably involved in some way. And the reason I even thought of a PT, because my doctor didn't tell me this, was as somebody with degenerative disc disease and someone that loves working out and being active, I get back flares and I'm in those kind of clinics a lot, right? Where they have the RMTs and the PTs and the chiros and everything. So as someone that's lived so much time in those clinics, I spent a lot of time in the waiting room. And what do you do in the waiting room, at least in Canada? You look at the bios of all the healthcare providers on the wall. And I remember for years seeing pelvic floor PTs up with the rest of the PTs. And I thought, how peculiar. Like, everyone else is just a PT and they just do like the pelvic floor. That's interesting and strange, but never really thought much of it. And I would sometimes read the conditions that they would treat or like things they can focus on. And it would, list things like constipation and urinary issues, postpartum. But I do remember pain with sex popping out. And obviously that kind of stayed in my head as someone that had painful sex. And so I thought, well, if the pelvic floor is connected to the vulvar tissues and contributing to pain with sex, and if pelvic floor PTs can work with pain with sex, then maybe they can help me in some way, shape, or form. And so I did seek out a PT, and for the mental health side, I sought out a therapist, but specifically I sought out a sex therapist because I knew that a lot of the mental health concerns and anxieties that I was having were very much related to sexual health. Yeah. Because what we see with lichen sclerosus is we kind of see three buckets of people in terms of where their symptoms fall. So some folks fall into the itch bucket, where their main or primary symptom or the big bothersome one is the itch. Other folks are going to fall more into that pain category, soreness, irritation, burning type pain. And then others are going to fall into that sexual health category, where it's going to be pain, yes, but more related to sexual activity, decreased sensation of the clitoris, which is, we talked about that scarring of the clitoral hood. It can, in some cases, lead to a decrease of sensation. So difficulty with orgasm or muted orgasms can be a thing. And so I was definitely in that sexual pain bucket. And so I knew that I had a lot to work out there. And so I wanted a therapist that was kind of hyper specialized in the ways in which sexual health can intersect with chronic pain conditions, specifically those that, affect genitals. And so I did an afternoon of, Googling and narrowing down my top 3 and going on their bios and seeing who was a good fit. And I found one, and I think her dissertation was on like vulvodynia and all of that and how that intersects with anxiety disorders. And so I thought, well, okay, vulvodynia is not quite LS, but it's close enough and in that same world that I think that she'll be able to appreciate how this can intersect with my mental health. And so I went with her and was with her for 4 years, and she was a godsend, as was PT. So I think PT, sex therapy, along with the steroids, daily moisturizing, which I cannot emphasize enough. It is so, so, so important. Those were the real big pieces for me. I know some folks do have a dietary component to their LS. I'm not one of those. So we see it's kind of a 50-50 divide in the community, where some folks are completely unaffected by what they eat and others are very much so affected by what they eat. Bless, I'm in the category where I can eat what I want because I have the world's biggest sweet tooth, and giving up dairy and gluten and sugar would be so challenging for me. So those were my main things, although I can appreciate that for some folks, they may need to add the diet piece in there.
Absolutely. It can present a lot differently, and management can look very different outside of that
Mm-hmm.
gold standard of topicals. You mentioned moisturizers. I
Mm-hmm.
hear that you're a fan of our
Yes.
balm.
I don't know if you heard at first, I was kind of nervous because it's called Enchanted Rose, and I thought it was going to smell like rose, like
Mm,
potpourri rose, like really strong. And I was like, oh, I don't know how I feel about that. But it's actually so subtle.
yeah.
The smell is so, so subtle that it's almost like completely neutral, but it's like just the slightest hint. So I was like, oh, thank God, because I was like, I don't know how I feel about like a bouquet of roses. Um, and I know that some folks are like not the biggest fan of like moisturizers that have strong smells. So I was like, okay. But the consistency is just beautiful. I love it. And in my years, I've been moving more into the balm territory of things. So I used to be a coconut oil only girl. I still do coconut oil. It works for me and my body. I can appreciate that it's not for everyone. I'm not really a barrier cream unless I have like an active tear or fissure
Mm.
where I want to create a barrier between external irritants like chlorine in a pool, urine, and that open wound. But otherwise, I like the balms because the consistency is just so nice. It's so nice and like buttery and smooth. It also sticks to the skin a little bit better than say like an one ingredient oil, which to be fair, especially in the summer, oils do tend to run and drip and have a little less staying power as I feel like the balms stay there, but they're not as thick as something like petroleum jelly or aquaphor where again, I'm using those more for barriers, but yeah, no, I love the Enchanted Rose Balm. It's amazing.
Yeah, it's all organic and made of natural ingredients. So any smell that you do smell is from the natural ingredients. We don't add any
Mm-hmm.
perfumes. So the subtle smell is a byproduct of a little bit of natural oils that are associated with healing. And then there is a little bit of different types of moisturizing oils. So it does, like you said, you like the coconut oils, and you can see I rubbed it in, and it's not
Mm-hmm.
greasy. It goes right into the
That's it.
skin. Yeah.
Yeah. And because a lot of folks too, what they dislike about the grease is that because it will kind of like leak, they find that like it gets onto their clothes and can sometimes stain the clothes, which I think is another nice thing about the balm having more staying power in that location.
Absolutely. And then dilators are often recommended in pelvic health PT for people with LS that are having pain with penetration that also have a little bit of loss of mobility of the
Mm-hmm.
tissues. When we think about penetration, we need good mobility of the pelvic floor muscles, which are skeletal muscles, just like your rotator cuff and just like
Mm-hmm.
everywhere else. So they can be weak and strong, they can be tight, and they can be rigid. And then we also have the skin itself, which is affected by the
Yeah.
LS. So the role of dilators is not just to provide a stretch. And in fact, I don't like using that word or that term.
Mm-hmm.
It's mobilization because we're training the brain that something coming inside is